Hi, everybody. Thank you so much for joining us. We are joined by Amanda Harris and Dr. Robert Quarles, and
Hello.
we're going to talk about stiffness and soreness that is related to kind of our new reality and working from home and what looking at a screen all day, looking down at your phone, sitting at a desk all day can do and how we can untangle that. So Amanda and Dr. Quarles, I'll let you guys introduce yourselves real quick and we will get started. If you have any questions, we'll have a Q&A session at the end of the presentation. There is a box that says Q&A. You can use that box to ask questions and we will take them all after this brief presentation. So take it away.
Ladies first.
Oh, thank you, Dr. Quarles. Hi, everybody. My name is Amanda Harris, and I am the exercise physiologist for the Richmond Welcome MD practice. I also own my own medical exercise practice called Reconnect here in Richmond, and have the pleasure of working with folks who typically are limited by anything from pain to previous injury to surgeries that have happened in the past. And enjoy working with them to help them move better, feel better, and move with less limitation. And I'm excited to speak with you about this topic today, as so many of us are doing more screen time. It's kind of ironic we're doing this, isn't it, Dr. Quarles, against like on the screen. So we'll help y'all untangle yourselves after this presentation.
Okay. I'm Dr. Bob Quarles. I'm a physician with Welcome MD. I do adult primary care, board certified in family practice. I'm an osteopathic physician, so one of the things that we're well versed in, I like to think, is musculoskeletal problems. So I'm going to turn it over to Amanda, and you know, she put together this show. I'm just here to add a little fluff and to throw my 2 cents in as we go, but I'll be delighted to handle questions at the end and take it away.
Well, thank you. As I mentioned earlier, I wanted to do this presentation for everyone since I recognized very quickly as I started to do more telehealth sessions and not in-person sessions, that when you are using your screen a whole lot more, especially from home, you have less opportunity to walk around. And I was starting to hear that from my clients as well, whether they were using standing desks or our more typical seating arrangements, sitting at sometimes at a kitchen table or sometimes at a home office. There wasn't that walking around between meetings. There wasn't going to a break room or a lunch room, even walking out of the parking lot to get in your car to go home. All that stuff changed. And we were doing meeting after meeting, sometimes rarely getting a chance to move in between. And so there's been a lot of sort of pain and stiffness associated with that, just because of the nature of this new environment. Dr. Quarles, you probably experienced some of that yourself, didn't you?
You bet. Yes,
Yeah.
less activity means more problems in a lot of
Right.
different ways.
Right, and physicians aren't immune to that. Even physicians with knowledge like yours.
Correct. And
Right.
I work out almost daily too. So even though I work out, sitting for extended periods of time in front of a computer still causes problems.
Right, and I think that's a really important point you make there, is that even those of us who work out a lot, like you do, Dr. Quarles, like I do, we typically work out in a section of our day. Most of us do, right?
Correct.
And it might be an hour or 2 hours of dedicated movement time where, which is super important, by the way, especially now where we can, use some stress release and some overall movement and get the heart rate working and get the muscles working. But when you stack that 1 to 2 hours a day against 8 or 9 or 10 sometimes hours of stillness in front of a screen, the two just don't compete well. And so I think we have to think about movement a little differently in this environment, and we've got to figure out how to meet it, how to manage to it, because it's probably not going to completely go away anytime soon, right?
Right.
So I brought this screen up because I wanted to really address the fact that sitting, and some of you have probably heard this sort of popular tagline that's emerged over the last few years about sitting is the new smoking. And, suddenly sitting is the devil, which, prior to all this, nobody really talked about sitting as being a problem. But, now that more and more of us are working behind computers, we're realizing that sitting has a profound effect on the body, and not just the joints and muscles, which is really what I want to concern our talk with today. But, some of you out there may have some real breathing issues. You may have asthmatic issues, or other pulmonary issues. You may have circulatory issues, and all our systems are actually impacted by this stillness. I mean, I'm saying sitting, but prolonged standing has its own issues, right, Dr. Quarles?
Correct.
What
Yes, this slide embodies osteopathic medicine in that structure and function are intimately intertwined.
Absolutely.
And especially the part about circulation. It's all about circulation.
Right, right. And if we're sitting or standing still, I mean, I hear a lot from my standing folks that, their knees and ankles are swollen at the end of the day, their feet are swollen. They're having some serious issues there because they're not even using the muscle pumps of their lower legs, to help return blood flow. And so we get into these sort of static situations with our knowledge workers. And I think we've got to recognize that even though the exercises I'm going to present today we're going to largely talk about mobility and just movement, just trying to get rid of that stiffness, but they're going to impact your ability to breathe better and the ability of your heart to circulate blood all over your system, especially to your brain, which for knowledge workers is awfully important, right?
Correct.
Okay.
Correct. And, important. I'm sorry.
No, go ahead, please.
The only thing I want people, when you said that your ankles get a little bit swollen, I want to impact that there are actually 3 aspects to our circulatory system, not just arteries and veins, but also the lymphatic system.
Yes.
And that's where that comes into play.
Right. And so when we look at these movements, as I mentioned earlier, even though my emphasis is going to seem to be around the movements, which is going to make everybody think about joints and muscles, it's important to remember that we are impacting the circulatory system, the lymphatic system within that, and we're moving fluid through our bodies, not just moving joints and muscles.
Correct.
So, yeah, thank you for that emphasis. I think that's super important. So I know everybody's sort of here for the exercises, or at least I assume that's the case when you read the promo. And so I want to jump right into this. And what I did was unlike myself, who really values whole body movement, and I like to think of movement as, part of a whole system, like movement happens within the body through the whole system. And rarely do we human bodies, other than in an exercise scenario, rarely do we move in isolated ways. But for the purpose of this, I felt like, folks tend to come to me with complaints about an area. They probably do that with you too, right, Dr. Quarles?
Absolutely correct.
They come in, they say, oh, my neck is killing me, my shoulders are killing me. So I divided the body up into roughly 5 areas that we're going to explore some different movement patterns in today. And we're just going to start at the top and go down. And the first area is going to be the stiff neck, which also many times incorporates the stiff upper back and shoulders. And, you can see, even just looking at my little circled image here, that this is computer posture, right? I mean, probably all of us recognize this. So whether your body is in a chair or standing at the computer is largely irrelevant. If you're suffering from a stiff neck, I bet your upper back and shoulders are stiff too. And any of those areas are just not really mutually exclusive, right? That kind of is a total package. So we know that as you're sitting there and you're doing these teleconference meetings, or even just getting absorbed in your work, maybe writing reports or writing emails, that you're probably not moving these areas very much. And your posture is going to tend toward sort of degenerating, right? You're going to start to move your eyes a little closer to the screen. That makes your neck go into an unnatural position where your head is forward of your shoulders. Your shoulders will eventually start to round, which makes your chest sink. You're probably not going to be breathing as well. I'm painting a really grim picture, but some of you are going to do this very subtly. Others of you are going to do it more dramatically, right? That's your experience?
Absolutely true. And you know what? This picture here demonstrates very good posture. Look, the butt is right up against the back of the chair. The back is nice and straight. The head is up. The feet are flat on the floor. So that's really excellent posture. But I bet you that's not the case in most folks.
Well, you're right. And I actually found a picture of somebody slumping and it was really not pretty. So I just decided we would go with this ideal image, just put this thought into our heads, right?
Right.
And hopefully as you're watching this, it's making you want to sit up a little taller. And just as Dr. Quarles said, move your butt back, sit up
Right.
nice and tall against the back of your chair and hold your head over your neck, because hopefully these words are big enough on the screen. You don't have to strain your eyes to see them.
Right.
So
I changed my position because of that picture.
excellent. I love
Mhm.
that. I think I might be doing that too.
Good.
So I'm going to go through a few exercises that impact this area. And my first one is really a chin glide. And these images here, I wasn't sophisticated enough with technology to drop video in. So forgive that. But I want you to see this image. This gentleman's on let's say a thin pillow. Hopefully his head's not so far forward of his neck that he has to have a really high pillow. But he's on a thin pillow here that allows his face to be level at the beginning. And then all he's doing is gently gliding his head backward on his neck, which in this case, since he's lying on the floor, it's going toward the floor. So you see he kind of creates a little bit of a double chin as his chin sinks down there. And that allows him to lengthen the back of the neck, and specifically those little muscles right at the base of your skull, the suboccipitals, that get so tired and tight after a lot of teleconferencing, right?
Good.
Anything else you want to comment on with that?
No, that's excellent.
Okay.
Use that all the time.
So this is a lovely one to do. And after you practice it on your back for some time and you get familiar with what muscles you should feel, it should never be painful. It should never be straining. It should never make you feel stiff. But once you get kind of comfortable with this notion, you can actually do it sitting in your chair. You can actually sit up and do some chin glides and give the back of your neck and those muscles at the base of your skull some instant relief.
Correct.
Really nice exercise to have in your back pocket. And for those of you who really would like to have these exercises, I think Ryan's going to put out some sort of a ability for us to generate some emails out. So you can just let him know that you're interested in getting the exercises, and I'm happy to send them out to you. So as we move down that sort of system, if you will, of the neck, upper back, and shoulders, we get to one of my all-time favorite exercises, which is the snow angel. And so, if you've ever done real snow angels, and this is probably a pattern that you recognize, again, things to consider are making sure that your head is in a fairly neutral position, meaning that if you need a little pillow under your head so that your face is level, so that your neck doesn't feel strained, then please use something like that. And I want you to notice that the palms are in the upright position. So the palms are facing up toward the ceiling, so that we really open the front of the chest and shoulder here as you're fanning the arms up and down. And my only real important consideration here is just keep breathing and make sure that you're not pushing through any pain or strain here. This should not be, again, these are gentle movements. They should not be painful or straining. You just move within the range of motion that you have available. So I realize that some of you are going to say, gosh, Amanda, I'm not so sure I have time to get up from my desk and get on the floor and do all of this on a break. But the point here is that you pick out some exercises that seem to address the areas where you're stiff, and they might be one or two out of this whole presentation, but if they give you relief, excellent. That's what we're really looking for. So that's the snow angel, which really kind of helps free up the upper back and starts to move the shoulder blades on the back. Remember, we talked about them getting really stiff and stuck with computer posture.
Can I add one thing here?
Oh, please.
Go back to the shoulders for a second.
Mm-hmm.
One of the things that in exercise, and especially weight training and resistance training, one of the things you want to do is incorporate proper breathing. So when you're coming up, you would want to be doing an inhalation there. Mm-hmm. Fill up your lungs going up, and then exhale going down. I don't know if that's important to you or not, but if folks get in the habit of proper breathing techniques while they're exercising or even stretching, it may help a little bit too.
I think that's a beautiful point. So thank you for reminding us of that. As you inhale, your rib cage should actually sort of expand and flare upward. And so Dr. Quarles' point is beautiful in that as those arms are fanning upward, your rib cage naturally wants to move in that direction. So when you use that breath, you use the balloon effect of your breath, inflating your lungs, then you're actually making use of that rib cage movement. And that actually helps to move the spine of the upper back, the thoracic spine, right? So you amplify in a good way the effects of the exercise. So yes, thank you for adding that. I think that's excellent. So that's the snow angel. And then I got into a little bit of rotation here, mainly because our stillness can lend itself to stiffness and rotation. And, you know, I usually talk about rotation when I talk about backing out of a car, because that's the way a lot of people rotate nowadays. That's like the only way they rotate, it seems to be. When I ask folks, when do you rotate? They say, oh, well, I rotate when I'm backing out of my car. Until somebody told me recently, well, I have a backup camera. I don't even have to do that anymore. And I thought, oh
I
my
was going to
God.
say that.
Yeah, we need to rotate, right? We need the
Yeah.
ability to rotate. So I threw this slide in, and I do want to point out that this young lady has exceptional range of motion in thoracic rotation.
No doubt.
So when you go to practice this exercise on your own, you may find that you go a third of the distance she has gone here. But points to remember are keeping the hips stacked. So in her case, the left hip is stacked directly over the right. We really don't want you to twist in the lumbar spine here. So keeping the hips stacked will help protect the lower back and the pelvis as you're really just rotating the upper back. So again, this is about getting some movement and relief in the upper back and shoulder area. The other thing is, if you find that you're very tight in the front of the shoulder, you don't have to take that elbow all the way out, like she has her left elbow all the way out in that second picture. So you can kind of keep it closer to your head and just really work on that upper back rotation. But again, following the breath, as Dr. Quarles mentioned in the last exercise, would be really nice. So inhaling maybe as you open the chest, and then exhaling as you close. But regardless, keeping that breath pattern, not breath holding, right?
Correct.
Yeah. So rotation is a really terrific motion for the thoracic spine. And then the last one I put on here was for those of you who say, I just don't have time to get on the floor, or maybe you can't get on the floor, or, you know, you're not in a bedroom, so you can't just hop on the bed. That's another really great alternative to getting to the floor. But if you're in your desk and you happen to have a desk chair that doesn't go all the way up, you could do what this young woman's doing and roll up a small towel and just place it behind your shoulder blades and do a little gentle backward bending in the chair. Now, you have to be careful with this one. If you have a bad lower back, you may want to avoid this at this point. If it's just stiffness and everything else is pretty good with you, you don't have any back pain, you don't have any back injuries, this could be a pretty safe little exercise to do. But, you know, again, just backward bending to sort of open up the front of the chest and then relaxing forward again. Just building some movement back into that upper back. And I do want to add just a quick emphasis here that this young woman does have her head cradled in her hands, so her neck's not having to do all that. So she's not pulling on her head, she's simply supporting the weight of her head in her hands.
Right. Good.
Yeah. So that's sort of the four that I put together for the neck, upper back, and shoulders. And I'm just going to keep going through these. If everybody's all right with it, we'll just
Super.
Travel right through. So the next area of emphasis is the stiff lower back. And I probably hear about this about as much as I hear about the stiff upper back. The lower back, both in sitting and standing, can get pretty tired. I think what a lot of us do, as opposed to this picture, is we sort of start to round our backs, right? You know, round the lower back, which of course affects the upper back too. But for those of us who tend towards sore backs or maybe have a history of back pain, that can be pretty uncomfortable, especially by the end of the day. So here's some options for moving your lower back a little bit. This is one that probably most people recognize, which is the old knees to chest exercise. You can do this on the floor. You can do this on the bed. Again, I like to make sure if you have to put something under your head to keep your face level, please do that, because we don't want to create strain in the neck while we're easing the lower back. And when you do the knees to chest pattern, one of my suggestions would be pull the knees to the chest and feel a little bit of a stretch, and then back off a little and give it a break and just sort of ease in and out of that lower back stretch. This should feel good, and you should be able to breathe through it. Of course, if it causes pain, you stop. But this is one that most folks recognize, and sometimes we forget when we're at the computer all day.
Nothing. You were right about your stretch. Nothing to pain. Nothing to pain. It does no good. And some folks may be so tight that when they try this double knees to chest, that it's very difficult to do. And it's okay if you agree, Amanda. It's okay to do one knee at a time. And
oh, absolutely.
Yeah, because
absolutely.
Sometimes there just may be so much muscle tension that's almost impossible to do. So one at a time until things loosen up.
Absolutely. And you can do that sort of gentle on-off strategy with the one at a time knee to chest as well. So, I decided on these next few that I would add some that were a little bit more adventurous for folks who might feel like they really want to move a little bit more. So if knees to chest seems kind of basic to you and you feel like you want a little bit more, then you can add a little bit of lumbar extension as well, which is really what I think our lumbar spines miss in sitting. When we sit, even if we're sitting up well, we are in a little bit of lumbar flexion, what we call lumbar flexion, which is a slight forward bend of the low back. And low backs don't love that. So I think, rounding the low back to let the lumbar muscles stretch is a really good thing to do, but also going the opposite direction, which puts those lumbar muscles in slack a little bit. It allows them to sort of take a break, and it allows the lumbar spine to find extension once again, which is probably what most lumbar spines would like to have. So this is cat-cow, which is probably familiar to most people. I think in yoga sometimes it gets called cat-camel. But rounding the back like a Halloween cat is the up portion, and then letting the abdomen sink toward the floor, maybe lifting the head and lifting the tail. Once again, this is our super mobile model here. So your back is probably not going to look like hers, but just getting that notion of lengthening along the spine and allowing the abdomen to drop a little, and then taking the head and tailbone down and allowing the spine to round a little. And you can just gently go into and out of these positions a little bit. Following the breath would be a really great way to do it.
That's great.
So for those who are a little bit more vigorous in their practice, some of you that have practiced yoga or want something a little bit bigger, here is child's pose going into what I would call prone press up, or also known as cobra pose in yoga. And so this isn't for everybody, but I threw this slide in there because sometimes when I give folks cat-cow, they say, gosh, I just want more of this. So this is an as tolerated scenario. So if you know your back is not going to tolerate this, please don't go out and try it. But it is a sort of bigger version of the previous exercise in terms of bending forward, getting that forward flexion in a very safe way, and then going into lumbar extension and hip extension for that matter, and lengthening the front body a little bit. Yeah.
Good. Couldn't agree more.
Great. So next we're going to take a look at the hips. This is probably my second or third most popular area to address these days. People coming to me with both stiffness and pain in the hips from too much sitting. Not uncommon in today's society. And what's really interesting to me about stiff hips, I'm learning more and more that some of our hip flexor muscles, especially psoas, can somehow get, can I say, neurologically repurposed. They get repurposed by the nervous system to be postural muscles. The body just, you're sitting in a chair, it's supported, or maybe you're doing a lot of standing, and the body just starts to use other areas to hold you up as it fatigues. And the hip flexors are a big one. So we hear a lot about tension, dominance, tightness, whatever you want to call it, in the hip flexor group. And so I wanted to give folks a little bit of a strategy here about how to open it up. Now, my first slide is for those who really don't want to put a knee on the floor. And I would say probably 50% of the people I meet say, I can't put my knees down because of knee replacement, because of knee pain. It doesn't matter why, but this is a nice option in standing for hip flexor stretch. Now, once again, our model is pretty athletic, but what I want you to see there is you can do this stretch on a door jamb or on a corner of a room, like if you've got a really big open room. And what I would change about this image is just to put his knee right up against that door jamb. So you really want to look at straightening the left hip in this picture and just straightening the thigh a little bit with a little bit of a bent knee. And I think that can actually serve as a very nice hip flexor stretch without necessarily straining the lower back. That's what the door jamb is there to do, is to support the spine and help you find the best position you can in this stretch. Do you have anything to add to that, Dr. Quarles?
No, that's my problem. And it seems, you said 2 or 3 that stiff hips are I'm finding that it's pushing number 1 pretty hard.
Is it?
So many people have problems with hips and glutes
Yep.
and hip flexors. It is just becoming more and more as we become less active and
Right.
not stay in as good a shape as we should.
Well, and even with those of us who are the most active, I'm starting to get athletes, very athletic people who are, doing killer workouts. Many of them, I hate to even say the word out loud. Well, let me just say stationary cycling, right? Stationary cycling has become extremely popular. And I think when that is your number one go-to exercise on top of a lot of teleconferencing, the hips are just bound to take the brunt of that. It's a lot of hip flexion. And it's not to say, and I tell everyone this, it's not to say cut out the cycling, but we do need to manage to that situation probably a lot more actively and more throughout the day and not just in one little block.
Right.
And so I think taking some breaks from those positions and opening up the hips in a safe way is going to be really key in that scenario, especially that scenario.
Right.
So my next slide, again, is for those who have the ability to put a knee down. And now this is my favorite only because with the knee bent at 90 degrees, you're going to get the long head of the quadriceps, which is the front of your thigh. And that's also a big hip flexor and also tends toward dominance with all our sitting postures. So, we hear a lot about psoas. Many of you have probably had psoas get released by a massage therapist or a PT, and it can be a very intense experience. But rectus femoris, that quadriceps, that front of the thigh, that long head of the front of the thigh, can also be very very dominant, very tight. And so this position actually allows you to really get both of those big muscles. And as I mentioned earlier, I like this on-off strategy in stretching, not just hanging into a stretch and making the muscle fight for its life, but kind of gently going into the stretch, holding it for a moment, and then backing off and doing that multiple times. I just find that it keeps you from really getting into a war, like a tug of war with your body, and gives the body an opportunity to kind of give you a little bit more room in that muscle in question here. So this little half kneeling hip flexor stretch is real nice. And I think the padding under the knee is really important, even for those of us who have really healthy knees. If you want to
This is my go-to for when everything tightens up in the front, as you know. One of the things you may want to consider is one of those garden knee pads. That's what I use at home. And I also want to emphasize, don't be too quick in this stretch. Let your body just acclimate to it and just gently go through it. Don't just get down on your knee and stretch it and then get up and say, well, I stretched it. No, you can't do it with this one. You have to just let everything settle into it and then gently put the stretch into that. I've just found that just don't worry about the time. Take your time with this and you'll get a lot more out of it.
Yeah, that really good points. And thank you for that, because that's coming from experience, right?
You bet it is.
Yeah, and this is one of my favorites in between telehealth sessions with my own clientele, is giving me 2 minutes to get down on the floor and go through my hip stretches. It makes the world of difference in the next session and the one after that. So this is a really nice one. And I felt like I needed to also include some hip rotator stretches in here. The hip rotators, lateral rotators of the hip, Piriformis and company, tend to be sort of a hot topic. And I think that once again, with all the sitting, we get into these tight hip scenarios where you just can't rotate your hips. So the top picture here is probably more familiar to most people as a piriformis stretch. This is the old figure 4 stretch that you might have learned in high school or college maybe. Once again, you can use a towel or something behind that left leg. This gentleman's got his hand back there, but if you can't quite reach that, use a towel or a belt or something to sort of pull the legs in toward the chest a little bit and feel the stretch on that right hip in this case. But also using that on-off strategy is a really nice thing to do here, slowly going into the stretch and backing out of it to get a little bit more out of it. Now, the bottom version is also a piriformis stretch, but it's different fibers that are getting affected here. And I won't really elaborate on that in this talk, but just to say that what this young woman is doing is she's actually pulling her left knee toward her right shoulder, and that's allowing the hip to kind of rotate inward slightly, which is the other direction the hip should be able to rotate. Your hips should rotate both out and in. Room for lots of good questions at the end.
Yes.
So stiff knees is the next topic. Now, this one's always interesting to me because knees can get stiff for a variety of reasons. And, when I first started doing medical exercise as a practice, most of the time when I heard about stiff knees, it was because of arthritis or maybe even after knee surgery or something like that, whether it was knee replacement or arthroscopic surgery or something. But I'm hearing more and more from younger people who have nothing going on in their knees, that their knees are really tight or their knees are really stiff. And once again, I think this is part of, prolonged sitting, prolonged standing, just that stationary nature of many of our jobs now. So once again, I've started with sort of some gentle movements for folks to try. This gentleman is using what's called a stretch out strap, which is a really wonderful gizmo. You can probably get it for, I don't know, $12 on Amazon or something. But you can also use a dog leash, which is what I usually ask my clients to grab. Don't worry about buying something. Just grab a dog leash, grab a rope and make a loop at the end, like whatever works. Yoga strap. But basically you put one end of the strap around the lower leg close to the ankle. You place your knees close together and you gently, and that's the operative word here, start to use your hands pulling on the cord to bend your knee. So you're not meant to keep cranking until your tears are squirting out of your eyes and your back is aching and your neck is killing you. But what I want you to do is just pull on the strap until you get a nice bend in your knee. You feel a gentle stretch in the quad. That's the front of the thigh. Hold it for a moment or two and then slowly let it out again. So once again, that on-off strategy of stretching seems to be really helpful. The other thing is if lying on your belly, like this gentleman's doing, makes your back hurt, you can see that he's got a pretty pronounced lower back curve here, which all of us do when we lie face down. It wouldn't be a bad idea to put a pillow under your abdomen just to mitigate some of that curvature, so you don't feel like you're compressed in your spine. Because if you really are tight in your thighs and the quadriceps, then you're gonna feel your pelvis rotate, which means that your back is gonna arch as you bend your knee. And so we wanna really be careful about this, that we don't wind up making your back sore while we're trying to make your knee move better.
Correct.
So that's probably my main point on this one. And why are we talking about quadriceps? Well, your quadriceps muscles, your front thigh muscles cross your knee. And as they cross your knee, the quadriceps tendon goes right over your kneecap. So your kneecap's encapsulated in it. And then it attaches down on your lower leg bone. And so when these muscles get tight from sitting, as we were talking about earlier, then the knees might feel really stiff. So that's why we're going after those quads here.
No kidding. Deconditioned state causes a lot of knee stiffness. There's just no doubt about it. And after you've done this, this is a very common exercise that's used a lot in therapy. And one of the things that can be done after weeks of getting used to this is just a slight isometric, and it can increase the ability to stretch out a little bit. That may be beyond the scope of this particular talk, but anyway,
Right.
it's a way to improve. I just thought I'd throw that in.
No, it's true. That hold relax method is a really good one. But you're right, Dr. Quarles. I had a hard time figuring out how I was going to describe that to our listeners without getting like down a rabbit hole. So if I'll just throw this out, if anybody's interested in learning more about that, you can absolutely contact me, and I'm happy to share it with you.
I'm sorry about that. I shouldn't.
Oh no, I think it's fantastic. It's a very true statement, and that's how I use it a lot as well.
Okay,
so
good.
we're gonna move into a more integrated way to get the knees moving, and so this is again a little bit more of an active way to get your knees moving. So this gentleman's on all fours and he's rocking forward and backward, and why do I like that? Well, you can see that there's some overlap here, right? You're hopefully as you're watching this, you're starting to notice that some of these activities are impacting areas other than the ones that I'm highlighting at the time. And so this would be one of those. You can get some good lumbar motion here, some lower back motion while you're doing this forward backward rocking. And I like the forward backward rocking mainly because you're actually moving the joint without a freely swinging leg. So we call this closed chain in my business, but essentially what it means is instead of sort of kicking your leg out, you're moving your body around your knee instead of moving your leg around your body or your lower leg around your knee. And that does make a difference in your nervous system in terms of how the actual joint relaxes a little bit. So involving more than one joint and potentially doing it in a way that moves the body over the joint can make the joint relax a little bit sooner than you would with a traditional stretch. So think of this as less of a stretch and more of a mobility exercise. I hope I didn't just talk gobbledygook too much there, but I do find that sometimes something like this, if tolerated, can even be faster acting than a traditional stretch like what I just showed.
Good.
And then finally, this is for those who have a lot more range of motion, obviously. Not everybody's going to have this. And for those of you who have most of the range, but not all of the range that this woman has, you could even sit on a yoga block or maybe a stack of books you could put between your ankles to raise you up and off of your heels. But once again, if you're not so sure about this or it causes any strain, I'd want you to avoid this. What I like about this particular exercise for stiff knees is that we take the knees into as much flexion as they tolerate. So again, you could use pillows, yoga blocks, whatever under the buttocks to raise yourself up a little bit higher if you can't really sit on your heels. But then you use your buttocks to come all the way up into what we call tall kneeling, which is the second picture. And so not only are you getting some loosening action of the quadriceps and knees, you're getting the activation of the buttocks, which really need some activation these days after we've been sitting on them all day, right?
Correct.
So that's the kneeling to tall kneeling position. Again, not for everyone out there, but I wanted to offer it as a variation for those who felt like they needed a little more action than maybe the other two. So we'll go on to ankles, which is my last area of interest, if you will, that I hear the most about getting kind of stiff and sore from all of this computer work. And I think most folks are familiar with calf stretching, basic calf stretching, which is essentially what this picture is showing. This gentleman's got his hands on the wall. He's got, one leg behind the other, and then he simply leans his body forward to get a calf stretch. Now, the way this is pictured, and this is kind of one of the reasons why I liked this picture, is that he's getting a calf stretch on his right leg, the long calf, the gastrocnemius or the gastroc, in the right leg on the bottom picture here. But then he's also stretching his Achilles tendon and his deeper calf muscles with his front leg. So he's kind of getting a twofer, and I love twofers, especially when it comes to things like this. Don't you, Dr. Quarles?
Absolutely. And this is also great for folks who have plantar fasciitis too.
Absolutely. It's excellent for them. But this is a really nice one, especially if you feel like you've been standing a lot. Standing at a standing desk will definitely make your ankles stiff and tight. And then, of course, sitting in a traditional chair can do the same. And sometimes people just tell me their hamstrings or their calves are just so tight. And this is a really nice way to mitigate that. Once again, I recommend that on-off strategy, mainly because you're moving. It's one less static thing you have to do. So it tends to work really well for this stretch. Now, I can't very well show ankle bending without showing what we call plantar flexion, but most people think of as ankle extending, right? Mm-hmm. And that's just heel raises. And most of us are familiar with heel raises. Some people say to me, well, why would I do that if my calves are typically tight? But what I want to remind you of is that, if you're stiff in the ankle, you're stiff in both directions of the ankle more than likely. You could use a little bit of movement in both directions. It doesn't mean that you have to do a lot of it. It just means you want to visit it, right?
Correct.
Make sure those ankles can move. So things to consider as you're doing your heel raises. My favorite tip to give folks is just to be sure as you go up onto your tiptoes that you're coming straight up. You're not allowing the ankles to roll outward, which could be dangerous for your ankles, especially if you've sprained your ankle many times before, or maybe even a few times before. So you really want to make sure the path of motion is nice and straight and tall here, and you're not rolling out to the sides. So you might do 5 or 6 of these in between conference calls if you have a stiff ankle, and maybe 5 or 6 of the bending ones, the forward flexion ones from the previous slide. So 2 really nice ankle motions. And then of course I had to give you an integrated version as well, which is simply child's pose, but one is with your ankles flexed in the top picture there, and the other is with your ankles, we'll say extended in the bottom picture there. And so once again, not everybody is going to be able to get into this position. If you feel like you could get into it mostly and not totally, you could always try putting a pillow on your calves, so that keeps you off your heels a little bit. But bottom line is, if it hurts or it feels like it's straining, just start with 1 and 2 of this series and not this slide. But this is a nice integrated way to work on ankle flexion and extension. And obviously you're impacting some other areas as well, right? You're impacting the knee, you're impacting the low back, and for all intents and purposes, the upper back and shoulders as well. So that's why I really like exercises like this. Again, that's like what is that, a fourfer?
Right. Absolutely. That's good. Good stuff.
Excellent. So all this to say, and I hope somebody was taking some notes on this and got some good nuggets, because I realize that not everybody's going to want all of these exercises, but I'm hoping you could find some that seem to really resonate for you and for your body. And what I wanted you to get out of this presentation is that, yes, keep exercising. You know, most of you out there are probably interested in exercise. You're at least doing some walking daily. That's the one godsend to all this staying at home stuff, is we've had some nice weather, so we've gotten out for some walks, pollen notwithstanding. So I want you to keep exercising, and we need to add some movement snacks. And I use this concept of movement snacks. I've borrowed this from biomechanist Katie Bowman, who I hold in high esteem. And she talks about taking movement snacks. That concept is wonderful because, you know, back in the 50s and 60s, we thought of eating in 3 square meals, right? And snacking was bad. And then as we go into modern times, we're learning that the body needs, you know, sort of a trickle of food throughout the day. And so we've learned that snacking can actually be good and is desirable over 3 square meals a day. And so I move that concept forward in the spirit that it was given to say, let's create some movement snacks for your body. Let's keep your body moving throughout the day and not just have one time of day where you're dedicated to movement and the rest is dedicated to stillness. I think you'll find that you feel better, you can breathe better, you'll probably have more energy, and you might even sleep better.
That's a great way to think about it. That's a great concept. Movement snacks, very good.
Yeah. Do you have anything to add, Dr. Quarles, to this? I mean, we stopped about 15 minutes ahead of time. We're happy to take questions, but.
Well, nobody's ever in good enough shape. It's a lifetime commitment. It's a lifetime struggle, really, to stay in shape, and it's got to be regular. And you have to change up and challenge your body all the time. And that's how stiffness can also take hold, where guys want a big chest and back, and then other things suffer. That's just a bad example, I guess. But also stretching is extremely important, and I'm afraid though that sometimes stretching can be too sudden, it can be too rapid, and it can be too far. So
right.
as you said and emphasized, nothing to pain, because there's always another day to fight.
Yes.
You know, there's tomorrow. If it only goes this far today, then be happy with that, and try to have it a little bit more tomorrow if you can, and if it doesn't cause pain.
Right. Well, and I think the kiss of death too is when we want to compare our bodies to the way somebody else's body moves. And
Right.
And I see that a lot of times in folks that come to me with an injury that has occurred doing, you know, pick your movement, but many times yoga or some sort of a practice like yoga, where the emphasis is on, you know, kind of how low can you go, or taking movement as far as you can, and folks will overestimate what their bodies can do, or they're trying to fit the mold of the instructor or somebody next to them. And so, you know, I think you would join me, Dr. Quarles, in emphasizing that, you know, it's not the method here that is at fault. We have to self-govern a little bit and know that we don't want to push the body through pain. And those methods are meant to help us move better. So we need to use props. We need to use modifications and find movements that feel good to our bodies and allow us to fight again another day, allow us to keep moving and move better, right?
Right.
Because I meet people who, when I ask them to bend forward, I always word it very carefully. in my movement screening, bend forward as if you were going to touch your toes.
Correct.
And I have folks that look at me and laugh and say, check this out, you know, and their fingertips are at their knees. But it's like, well, don't laugh. That's just what you have today.
Right.
And you may never touch your toes, but let's work on improving what you have today. And
Correct.
so that's just, we got to meet the body where it is, right?
I remember that you did that with me.
Oh, good.
And I could not touch my toes.
That's okay. That's okay. So I'd love to open it up to questions, or Ryan, if anybody has exhibited any questions, submitted questions.
Yeah, and the best way to do that, if you are watching us through Zoom, there's a little Q&A box that you can submit your questions for Amanda or Dr. Quarles. If you're watching us on Facebook Live, you can just leave your questions in the comments. My question is there certain, you know, if you're stiff and sore in, say, your neck versus your ankles, is that, you know, is that directly related to certain posture problems when you're sitting? You know, obviously you want people to be exhibiting the perfect posture that we showed in that first slide, but are there certain ways that we're sitting that will lead to problems with the neck versus problems in the hip, problems in the ankles?
Certainly can be postural, but it can also be underlying mechanical or structural too, and that's what you really have to be careful for. And if routine stretching and correcting posture and strengthening doesn't take care of it, that's when you seek further help and an analysis.
Yeah. Well, and I'm glad you said that, because I think it's really important not to let these things linger and to downplay them. And then to get back to sort of your spirit of your question there, Ryan, I think that, you know, in most cases, if you're sore in the neck, it probably is your, you know, head, neck, and shoulder posture and how you're holding your head. I think it's very easy, you know, I hate to tell this story, but I don't know how else to do this. When our ancestors were hunter-gatherers and we were out, you know, looking for food all day, the eyes were constantly moving and they were taking in peripheral vision and, you know, close vision, things that were way off in the distance, things that were right up close, and they were focusing on many different things. And I think that, you know, in our modern day and age, as we're all looking at computer screens, that's fundamentally changed. Now we're focusing on something that's close to us. And many times we're having to really use our brains on. So we're writing reports, we're writing articles, we're teleconferencing and trying to actively listen. And when we do that and the eyes are so focused and the brain is so focused, I think it's very natural for the head to start to move toward that screen. And that's when those neck muscles become essentially very tight, and it creates that cascade of the rounded shoulders, et cetera. So I do believe that neck strain can be very much related to how much you're on your computer, whether you're sitting or you're standing.
No
And then
doubt.
the ankle thing is, I think, more positional, but can also be related to many other issues, as in footwear and other things that this webinar is really not designed to address. But I think just that static position is what can really create the ankle stiffness more so than anything else.
No doubt. And, you know, I find that a lot of times at computer, I catch my feet. I'm up on the balls of my feet. You know what I mean? So I'm leaning forward. I'm up on the balls of my feet, and that's causing a lot of ankle stiffness. I had a webinar question from Claudia. Is Claudia out there? Raise your hand, Claudia. He said hello.
I believe they are on. Yes.
Okay. Hi, Claudia. Claudia's question is this: I especially develop a painful neck and shoulder, usually one-sided, when sitting at the computer for extended periods of time. This is classic. We hear this all the time. I try to be conscious of keeping shoulders down, elbow and arm positioning, and angle relative to the desk height, but I still end up in much pain that can make comfortable sleep difficult. Thanks for any suggestions, Claudia. Okay. Well, we should talk about computer screen position. It should be eye level. Our feet should be flat on the floor. Our arms should be parallel to the floor. And that's best case scenario.
Mhm.
But one of the most important things when we're doing computer work is that we need frequent breaks from the computer. We have to do that. Otherwise, it just gets locked in. And those head and neck stretches that Amanda perfectly showed us, along with maybe even some shrugs. She didn't get into the shrugs so much. And then if that doesn't work, um, some strengthening and stretching. If that doesn't work, then maybe there is a need for further evaluation. The tip off for Claudia here is that she says it's usually one-sided. So if we keep coming back to one side, maybe that needs to be looked at a little bit. So that's just my input into that. And Amanda, I'm going to let you add to that.
Yeah, I think thank you for that. And I think that's very true. That one-sidedness always is a yellow flag in my mind as well. And
Right.
one of my questions would be, is it in your dominant arm side? Like, is it in the side that you're mousing with the most and sort of moving around a little bit? And I find that more often than not, that's the sense that people give me, is it's usually in their dominant arm side. I met somebody recently though who was an exception. But many times when I hear that and see somebody with that, when I do a little bit of questioning, I find that they have done really no exercise for their upper body. So to your point, Dr. Quarles, I think, the muscle balance around the shoulder is usually a big issue. And, we didn't really get into a lot about muscle balance today, but needless to say, as we start to sort of round forward, then the shoulders start to cave in a little bit. And it's very normal for the muscles on the front of the shoulder to become sort of dominant and shortened and take over the actions of the arm and shoulder. And that means the muscles in the back are sort of holding on for dear life and then fatiguing. And, a lot of folks think, oh, well, they're just so tight and they crush them out with a ball. They get on a ball and they're trying to crush out that muscle under their shoulder blade. And that muscle under their shoulder blade gives up the ghost, right? Like it just is like, okay, I can't hold on any longer. Now you're stretching me. And so I think part of the situation that happens in these nagging, pains in the shoulder blade area is that they get misinterpreted as being something that's shortening and holding tightly instead of something that is really crying for help because it can't hold on any longer kind of thing. So, many cases what we need to do is actually teach those muscles how to re-engage, open up the front of the muscles, stretch the chest and the anterior shoulder, and then really activate some of those poor muscles on the back that are really holding on for dear life.
Right.
So
And what's going to happen if that doesn't, if those steps aren't taken, then occipital headaches and are going to follow suit. There's no doubt about it.
Yeah. And so I know you see one end of that cascade, and ideally I see the other, but every once in a while I get somebody who's got the headaches and the whole thing going, and we just recognize it as, wow, this is how far this process has gone.
Correct. Absolutely.
Yeah.
We have a question that Dr. Quarles kind of touched on, but someone's asking if we can go over the proper desk and adjustable chair height for sitting position, especially if someone is short and they're trying to have flat feet.
Okay.
Okay, well, all kinds of things can be used, but the most important thing to start, make sure that computer is at eye level so that you can exhibit good posture there. Make sure your butt's up against the chair. And if you have to, put some kind of box where your feet can be flat. They're plentiful. You can build your own, use a footstool. That's a way to do it, or an adjustable chair that can go up and down.
Mm-hmm. Yeah, I actually, I get made fun of a lot in my own office because I have a chair that I like. I'll say like, don't love, but I actually put a pad in it. It's actually a balance pad. So it's actually a piece of exercise equipment, but I put a balance pad in it that gets me up high enough to where my elbows and arms are at the proper position. So I've got that right angle bend in my elbow. And then sometimes like today when I'm teleconferencing, I actually raised my laptop up so that I don't have to look down at the screen. And I think that is really important, that you situate yourself as needed to have optimal positioning so that things don't hurt so badly. I think your idea of having something under the feet is perfect. And that's exactly what I would echo too. I've used a stack of books. With myself being lifted up mechanically, I have to put something under my feet too. So stack of books works too. You can find things around your house to make it work.
And if you're standing at one of the Vera desks, I believe is what they're called, then it often helps to alternate having a foot raised, one foot up on a footstool or a book or a platform, and then alternate that. That also is helpful as well.
And could I just add, I'll piggyback on that and say, if you're going to do that, just make sure you're not sinking into one hip and cocking your hips,
You bet.
because that'll wreck your back. So if you're going to have one foot up, just keep your pelvis level and stand up tall, and make sure you're not just sort of, slinking down into one side.
Great additional point.
Mm-hmm.
Another question. What might help the resistance and popping sound that this person is experiencing in their neck and shoulder? It's only on one side of the neck when they extend back toward the shoulder.
Resistance and popping sound. Popping and clicking are signs of inflammation. So we got to get to the bottom of the inflammation. First thing I would do, I would want to see what's going on with the cervical spine. There might be some spurs, there might be some arthritis, maybe some worn discs that are setting up an inflammatory response. I'm going right to the medical thing right away, but that when you hear popping and clicking, that is a sign of inflammation, or just extremely tight tendons, one or the other. But if your tendons are extremely tight, you don't want to go stretching into any kind of pain pattern too. You just want to take that very gently. But I would want to know what's going on underneath before I would really recommend anything else, or you do any kind of mobilization treatments. Amanda.
Well, all I would say is, if you came to me and you were popping and clicking without pain, then I would feel comfortable trying to put you into a face-up lying position and getting you as well aligned as I possibly could, and taking you through some gentle movements like the chin glide, like the snow angel, and just seeing what your report is. Does that hurt? Do you have limitation? Do you have pain with that? And just do a little bit of movement investigation. So I'm just looking at it through a slightly different lens. And if I'm getting, oh, this really hurts, or like I'm getting a stabbing white hot pain through my shoulder when I do this movement, then off to Dr. Quarles you go, and I would really want you to get medically evaluated. Or if you said, I've got popping in my neck and shoulder and it's painful, then I would want you to get it checked out medically before you came here. But usually the non-painful popping, I'll go ahead and investigate a little bit of gentle movement. And if it's not painful as we investigate movement, then I might start a very gentle mobility and strength program just to start to get basic stability back in the neck and shoulder. But pain with the popping needs to get medical clearance for sure.
Good.
Mm-hmm.
All right, we are out of time. I appreciate everyone who tuned in to watch us today. And of course, we appreciate Amanda and Dr. Quarles taking time out of their busy day to present to everybody. After the show, you will receive an email from us that'll have a link to the recording of this webinar. We will also have information from Amanda. I believe she has a list of all the exercises that we talked about today that we can share as well. So you will receive additional information from us. If you have any questions, you can email us at info@welcomemd.com. That's info@WELLCOMEMD.com. You can also visit welcomemd.com for any additional information that you have on our practices. So again, thank you both. If you have anything else, please feel free to add them here. If not, we'll see everybody again soon.
Great job, Amanda. You did a good job with this.
Good job to you too. And if I could just ask folks, if you want exercises plus instructions, just let Ryan know when you get the email that you're going to send out, right, Ryan?
Correct.
Okay, terrific. And I'll make sure I get those exercises to folks who want them.
All right. Thank you all. Have a great day.
Thank you.
Take care.